This is Cindy Gordon from Starmark. Thank you so much for your time this morning and joining our webinar. I am conducting on behalf of Insurance Network America. I am a senior account executive with Starmark, responsible for sales and distribution through our managing general agency distribution partners, such as Insurance Network America. I have Mike Diven joining us this morning from Insurance Network America, and I'm going to turn it over to him for just a quick introduction, and then once he's done, we'll get into the presentation. Go ahead, Mike.
Thank you, Cindy. Hey, we just really want to thank you folks for showing up today. INA, we're a managing general partner, and we have been working with Starmark for, oh my gosh, 26, 27 years. Does that sound right, Cindy?
Yep, sounds right.
It's been a while. And we do business all over the United States, and so no matter where you are, we probably can help you. We appreciate you getting on today. If you have any questions at the end of this, if you'll just type them up into your little box, we'll try to answer a few of them afterwards and get to those hopefully. Otherwise, be sure and contact your INA rep later and we'll get you taken care of. Meanwhile, I want to thank Cindy for doing this. We so appreciate you, and I'm going to let you take this thing over.
Great. Thanks, Mike. Yes, and just to kind of piggyback off what Mike was talking about, I'm going to go through the presentation in its entirety, but we will definitely have time for questions at the end. You have a couple options for asking questions. Again, you can put it into the question function in your control panel, and at the end of the presentation, I'll review any questions that have been typed in. You also have another option of when you dialed into the audio portion of the call, if you entered in your audio PIN, you can at the end of the presentation raise what's called your virtual hand. So you click on the little hand, raise your hand. I'll see that you have a question, and I can unmute you, and you can ask the question to over the telephone. So you have that option, and then also just entering the question into the question box on your control panel. Okay. So getting started with the presentation, a little background for those of you who maybe don't know Starmark or are new to hearing about Starmark. We've had a product, a self-funded product for many years, since 2007. That's a level-funded product that we've been marketing in several states. When ACA came around, we expanded our marketing of the product to kind of nationwide. So we're a nationwide carrier. Expanded the product because of ACA, and many states that have not historically been community rated were going to be community rated with the new regulations. So self-funded is kind of our expertise, and we just recently, as of January 1st of 2016, launched a minimum essential coverage or MEC type product that is sold and offered alongside our Healthy Incentives or our Healthy Edge product. Healthy Incentives and Healthy Edge is the naming of our self-funded product depending on geographically where you're located. So there's some locations where it's referred to as Healthy Incentives and some state locations where it's referred to Healthy Edge. So launched as of 1/1, we feel that the MEC product is a great product to have offered alongside of our self-funded product. Satisfies the ACA individual mandate provision, so it gives you an opportunity to offer, a minimum essential coverage plan along with maybe a buy-up type PPO or CDHP plan to help you, obviously satisfy the needs of different classes of employees or different categories of employees for a particular group, while still offering coverage to all. So to get into the product a little bit, it's a first dollar benefit. Provider discounts for covered network services. The network that we use for our MEC product called Starmark Preventive Plus is PHCS. So it's a little different from our Healthy Incentives product that uses the network either Cigna or Aetna, our most common networks. With the Preventive Plus product, we do use the PHCS network. There is stop-loss insurance protection on the MEC product. It's on an aggregate level only. So those of you who are familiar with the Healthy Incentives know that there's a second ag. In this particular case, with the type of coverage we're talking about just being preventive, it's just an aggregate only type product. It does have the traditional cash surplus option, so that means that after applicable run-out period with the Preventive Plus product, the group does have the potential to receive 100% of any surplus in their claim account back. And then again, as I stated, it does satisfy the ACA mandate. Let's see. Talks about the ACA mandate. It's not comprehensive major medical coverage, so that's something we want to make sure everybody understands. We do have 3 plan designs with our MEC product to choose from. So there's 3 different plan designs, one of them being the most restrictive, obviously, where it just covers preventive only, and I'll get into those specifics in just a few minutes here. The plan is a traditional cash surplus with a 9-month run-out period. So there's a little flexibility with our Healthy Incentives product on what type of run-out you choose, but with the MEC product, it's a standard traditional cash surplus with a 9-month run-out. The broker compensation is $8 per employee per month, and that is not adjustable, so it is a flat $8. Some product packaging guidelines, and I've talked a little bit about this already. It must be offered with a Healthy Edge or Healthy Incentive plan design. So it is not yet a product that we are marketing or offering standalone. Not sure if that'll change in the future, but right now it does have to be offered alongside our Healthy Edge or Healthy Incentive. You must have 10 or more enrolled employees in the Starmark Healthy Edge or Healthy Incentive, and you must have 10 enrolled in the MEC product, in the Preventive Plus product. So it's 10 in each plan. There are some limitations, state-specific limitations, and I'm not going to get into all of those, but there's a few states that have some requirements on minimums, but we do have some good information on our website regarding those states. A separate application for insurance coverage for stop-loss insurance must be submitted for Preventive Plus plan design. So you'll have an application for your Healthy Incentives or Healthy Edge, and then a separate application for the stop-loss cover or the MEC coverage. You have to have the same anniversary date. So the Healthy Incentives, Healthy Edge plan and the Preventive Plus MEC plan must have the same anniversary date. Just some logistics that to share with you. They'll have a separate ID number, separate documents, separate utilization reports, and separate surplus accounts. So they do operate separately. You know, you might have a Healthy Incentives or Healthy Edge product that has a different surplus option or a different run-out option. That's fine, as long as the anniversary dates match. Let's see, just a few other things. You know, it operates as a separate product, so there's separate login information and separate login IDs that will need to be created. And then the Healthy Dental is a product that we aren't going to get into today, but the Healthy Dental and the Healthy, our HRA product are not available with the Preventive Plus, so just a little caveats there. So let's get into the plan design. Pretty straightforward. It's not going to take long to go through, but we have 3 plan designs. The first plan design is called our standard plan design. It basically has 100% coverage for the ACA required preventive care. It has a component that many MEC products or MEC type products out there don't have, that I've seen, at least from my experience. We offer as part of the product a teledoc component. So for a $40 fee, those who have our Preventive Plus MEC product have access to use teledoc for a $40 fee. The consult fee is subject to change during the plan effective date, so it's basically based on teledoc fees, and it does look like that as of November, the consult fee will change to $45, so something to keep in mind. Another component of the product that we offer is an RX Savings Plan or RX Savings Plus discount card. So even though the MEC product doesn't cover prescription drugs, those who have the Starmark MEC or Preventive Plus product will have access to a discount program for RX if they have a child that's ill and has to have, you know, some sort of a antibiotic. They can go to the pharmacy and at least get a discount on the cost of the prescription. Obviously, physician specialist and office visit not covered except for the preventive care that's stated. And then there's an in and out of network limit that doesn't really apply since it's preventive only, but we do have to state it. Coverage is in network services only. Again, the network is PHCS. And the product does include our health center and My Nurse 24/7. So those are a few services that we offer to our Healthy Incentive and Healthy Edge members, and they will also have that available to them as an option with this as well. Then we have, in addition to our standard plan, we have what's called our Package 1 and Package 2 plan designs. Those plan designs are just slightly different from the standard plan in that they're a little bit richer benefit. They offer a few other options. So you still have your preventive coverage. You still have teledoc. Now, the difference with teledoc on this one is that because there's an actual office visit copay, the teledoc copay mirrors the office visit copay. So on this option, they have a $20 copay per consult with teledoc. They still have the prescription drug. The other benefit is that with this plan, they have a prescription drug generic only. So the retail copay on this would be $15 for generics, and for mail service, it would be $38 up to a 90-day supply. Just important to note that preferred brand and non-preferred brand drugs are not covered, but they can still receive that discount when participating pharmacy is used. It also has a physician office visit copay option, $20 per visit. Now this plan does have a maximum number of visits, so they can't just go unlimited to the physician or to the doctor's office under this plan, but they do have a maximum of 3 in-network only visits per plan year. So maximum of 3, and then the office visit copay is $20. And that's pretty much it for the plan 1, package 1. And then the difference between package 1 and package 2 is the package 2 offers an emergency room component. So package 2 has a $150 copay for 1 emergency room visit per covered person per year. So again, it's adding an emergency room benefit, but it's not unlimited. It covers the 1 ER visit per year per covered person. Just to kind of clarify too, the following services are not covered as part of the ER visit: transportation, any inpatient services, any services or visits exceeding that 1 visit limit, and charges for non-emergency treatment received in the emergency room, and then treatment services and supplies received in an urgent care center. So that's important to clarify. It's strictly an emergency room benefit. So if they go to an urgent care facility, there is no coverage. So that's basically the 3 different options they have. So far, I will tell you that our most popular, we've had some really good success with our MEC product since 1/1, but I can tell you I'm pretty sure 100% of what we've sold so far has been the standard plan. But those other 2 options are there if you have an employer who wants to add a few little extra benefits to the minimum essential coverage. They do have that option. State availability. State availability is pretty much across the board with where we offer our Healthy Incentives and Healthy Edge products. One state comes to mind that due to some filing issues, we do not have our MEC product available yet, and that is the state of Washington. But as far as that goes, I think that's the only state that we do not have our product, the MEC product, available. Aside from this, there's a few states that we don't have even our Healthy Incentives product in, or Healthy Edge product in, like New York is one of them that comes to mind. So in a few minutes here, I'll pull up a product availability chart so you can kind of see where the product is available, but it's pretty much where we have our Healthy Incentives and Healthy Edge product. A few things to keep in mind too within a state, even if the product is available. There's a few states that have possibly some zip codes that might not be included. So we do have another document that kind of outlines by state what zip codes are included with our product. The reason for that is the MEC product, we wanted to make sure that with PHCS that there was sufficient primary care physician coverage in a particular area. And we found some zip codes where we used a threshold where we found that the threshold probably wasn't good enough to offer the product in because we'd be concerned about people not having providers to utilize. That's changed. It's changing ongoing. We continue to research and make sure that we're not missing any zip codes that have possibilities. So we've actually updated that and expanded it. So again, it's a pretty broad area that we cover, so I wouldn't anticipate too many issues with coverage for the MEC product in a particular zip. All right, let's see here. Okay, a little bit about contribution and participation. Employer contribution, the employer must pay 100% of the Starmark Preventive Plus employee cost. That's employee cost only. Dependents are not included, are not subject to this. But The cost for the employee must be 100% contribution. There is no minimum employer contribution requirement for dependent costs. As far as participation goes, 100% of the full-time employees not enrolled in the Healthy Edge Healthy Incentives Plan must enroll in the Preventive Plus plan, excluding valid waivers. There is no minimum participation requirement for dependents, but for the employees, if they don't enroll in the Healthy Incentives or Healthy Edge, they need to enroll in the MEC plan unless they have a valid waiver, then they would be eliminated. So 100% after valid waivers. Underwriting enrollment for the MEC product. Step back here for those of you who are familiar with our Healthy Edge, Healthy Incentives level funded or self-funded product. There is, we do individually underwrite that product. As far as the MEC or Starmark Preventive Plus MEC product, we do not medically underwrite this product. So the only piece that is subject to the medical underwriting is the piece of the individuals who would be covered under our Healthy Edge or Healthy Incentives product. Express Connect enrollment is not available at this time, as it is for the Healthy Incentives, Healthy Edge piece. As far as the Starmark Preventive Plus piece, we have a spreadsheet that we can use, that we use to just upload into our system for the MEC enrollment. So even though we don't have that enrollment capability through our Express Connect telephonic process, we do have it. It is very simple, and we do have a standard spreadsheet that we can just upload into our system. Members can move from Preventive Plus to Healthy Edge or Healthy Incentives and vice versa only during open enrollment. So once a group is established and a member enrolls in either or plan, they cannot change from one plan to the next until their next open enrollment period. Let's see. Basically, the Preventive Plus and Healthy Edge and Healthy Incentives groups must be submitted to underwriting together. Termination. Termination of the stop-loss insurance contract for the Healthy Edge or Healthy Incentives plan simultaneously terminates the stop-loss insurance contract for the Preventive Plus. So this goes along with the fact that we only offer the Preventive Plus alongside our Healthy Incentives, Healthy Edge. So if that terminates, the Preventive Plus plan also terminates. A little bit about documents. The plan documents are pretty similar to what you would receive for the Healthy Edge or Healthy Incentives. You'll have a plan document, stop-loss insurance policy, admin service agreement. There'll be monthly billing. You'll know there'll be a piece for the claim pre-fund, admin cost, and aggregate stop-loss premium. Reinsurance fee does not apply. We do have online bill pay available, and the bill is also accessible via our document center. The healthcare utilization reports that you'll receive basically shows prescription drug utilization for generic and mail service information. And then the last item is just letting you know that we do have marketing materials available regarding our, obviously our MEC product or our Preventive Plus product located on our Healthy Edge or Healthy Incentives toolkit. If you do not have a link to our Healthy Incentives or Healthy Edge toolkit, you can reach out to myself or to your INA benefit specialist or Mike Good, and they can get you access to that. The toolkits are nice because they are a live link, and it takes you, if you save it to your favorites, it will take you to the toolkit that has the most up-to-date information within those toolkits. So it's a good link to save because it does take you to the most current information. And that is about it. Not too long of a presentation. MEC products are pretty basic. I think the key is just, knowing that it must be sold alongside our Healthy Incentives and Healthy Edge products. And if you aren't familiar with that, INA has been marketing those products for us for many, many years and are definitely experts with the product. I think at this point what I'm going to do is I'm going to open it up to any questions that might be out there. If you have a question, again, you can type it into the question section of your control panel, or you can also raise your virtual hand. So I'm going to start with looking at some of the questions real quick here. There's a network question that came up. Does your network include Mayo Clinic for those of us who sell in Nebraska, Iowa, it looks like? I'll look into that and get back to you. I'm not positive since it's a preventive only type product. I'm not sure how vast the network is. So I will get back to you on that question. Thank you for that. And I will follow up with questions that I don't have the answers to. Is Medicaid considered a valid waiver? Yes, Medicaid is considered a valid waiver with us. And let's see. Asking for copies of the slides so they can go over with their team. Yes, we are going to actually have, this presentation has been recorded, so we'll be distributing that after the webinar in the next day or so. You'll have access to it. And it looks like someone's asking, where do we get quotes? You would reach out to Mike Bibbin if you do not have a specific Insurance Network America sales rep that you work with. Reach out to Mike Bibbin, and he can get you help with any quoting information on both of our products. What is considered a valid waiver? Valid waivers are pretty much anything individual coverage, Medicare, Medicaid. The only thing that, over the years that Starmark has not considered a valid waiver would be like a catastrophic type plan, but we pretty much consider any other individual Medicare, Medicaid type coverage or spousal coverage covered under their spousal plan to be a valid waiver. We're very liberal with that. Let's see, good questions coming in. Are the 3 offices visits per person or per family? They're per individual. The 3 office visits are per individual. What are the participation requirements? Participation requirements are 100% for the MEC product. The minimum essential coverage, the Starmark Preventive Plus product, is 100% coverage, but that's after valid waivers. Our Healthy Incentives and Healthy Edge products do have a 75% participation requirement, and that's also after valid waivers. All right, let's see if there's more here. Is the comp per employee or per enrolled member including the comp is per employee per month. And I think lots of good questions. And I think I hit on all of them. I'm just going to check. My only follow-up from the questions, it looks like, is my Mayo Clinic question. So I will be sure to find that out and make sure that the person who asked that question receives a response. Let's see. I don't see any other questions in the panel. Let me just see if anybody has raised their virtual hand that wants to ask a question over the phone. Well, it does look like it. I'm going to try this. Hopefully, George, you've, I don't know if you've asked your question in the question panel, but I'll unmute you and see if you still have a question. You can go ahead and ask your question. All right, well, George, oh. All right, looks like whoever had a question does not have a question any longer, so they might have typed it into the chat function. Let me just give one more scroll through to see if there is a hand raised question. And, okay. There's a few questions coming in that I'm going to follow up on. You have to be very careful. There's some questions that came up about, can you discriminate by class? I'm going to follow up with you offline on that or send out some information. I mean, Starmark does, with our Healthy Incentives and Healthy Edge products, allow carve-outs, but you do have to be very careful that you're not discriminating. So as far as offering the MEC product and any type of PPO type buy-up product, we have to be careful that that's offered to everybody, and if not, that there's a distinct class of employee that is a carve-out type situation. Let's see here. Can you offer 3 plans at the same time? So you can only offer 1 Preventive Plus product. You can have 2 Healthy Incentives or Healthy Edge plan designs alongside each other, but the MEC product is only 1 plan design. So again, you can have 2 Healthy Incentives, Healthy Edge dual option type products, and then have the 1 MEC product. Why would an employer buy this? Well, I think it's offered to help an employer satisfy that individual mandate. So it's cost to them at a minimal cost to cover those benefits that are required by ACA and the individual mandate. So, you know, it satisfies that requirement and eliminates them from any penalties associated with that. Can you discriminate by class of employee? Again, I think that's a conversation that we should have in more detail, but you can do carve-out, but yes, no, you cannot discriminate. So it would have to be a distinct class of employee that we would need to make sure that you're following all discrimination guidelines. Is there appointment paperwork? Yes, there is appointment paperwork. INA, Insurance Network American, can guide you through that. We don't require appointment paperwork until you submit your first piece of business. So you can work with INA on any quotes, and if you get to the point that you're going to submit a piece of business to us, then at that time you can provide your appointment paperwork. Let's see. What is considered when pricing for the MEC plan? You know, the MEC product is pretty straightforward since you're only covering in, for example, the standard plan, the preventive services. So what really guides variance in the cost of the MEC plan based on location is geared more towards what type of discounts we get through PHCS. So you will see a pricing difference based on network and the discounts we get. And of course, you know, a little has to do with, you know, geographically what the costs of care are, but it's generally driven by what network access to discounts that we have. Let's see here. A lot of good questions coming in. I think that is all so far. If there was any question that I missed, I mean, there was questions coming in like crazy, so if I missed anything, I will review these afterwards, and I will make sure that we get you responses to any questions that you had. It does seem like there's a lot of questions around what you can do as far as offering to specific classes, and you know, that's a webinar that could probably take an hour. So I would recommend that you reach out to any of your INA sales reps or to you know, who you consult with as far as those requirements go, and see what type of assistance we can give you and what type of guidelines you need to follow. I think that's all the questions that have come in so far. So really good questions. There was quite a few of them. And again, I will review the questions that came in to make sure that we did answer all of them. And as far as that goes, if there's a question that you have, again, you can reach out to Mike. And Mike, I don't know if you have any closing remarks you want to make before we end the call.
I just wanted to say thank you, number one, again, Lori or Cindy, for doing this, and also for those of you out there that do have questions, you know, we are fully up to speed on all the ACA regulations. You know, so if you have the larger groups, you're trying to know, you know, is your group a true applicable large employer? Then we have the ability to make sure that you're doing your math right and make sure that group is, you know, qualified for that, and then point you in the right direction to help that employer avoid his employer, or actually meet his employer obligations, so he's not in line for a fine. So have questions, give us a call. We can help you. And I think our number's up there. We'll get you set up. We thank you for your time today.
Great. Thanks, Mike. Thank you, everybody. I appreciate your time, and have a great day. Thank you very much.